I'm a serial entrepreneur who got into healthcare just by chance. An older Japanese friend of mine called me from the hospital. True story. He had a heart attack, was having a quadruple bypass, and was a diabetic, but they misdiagnosed him for 10 years. When he got out of the hospital, we couldn't go out to eat or drink anymore because he didn't know the nutritional values in his food. When I told him, what did the doctors give you, or the nurses in the hospital, they gave pamphlets. 2002, and they're using paper diaries. So I come from Wall Street, financial IT, used to multivariate data sets, and we spent 4.5 years in R&D listening to doctors, patients, nutritionists, and what they told me was, hey, there's a big disconnect between how people understand health. And one of the key parts is nutrition. So if we could use a cell phone, the ubiquity of a cell phone camera, take a picture of everything you're eating and drinking, and if the system somehow could automatically extract the kilocalories, salt, and carb values, and if it could help you with drug compliance, and if it can motivate you, change your behavior, and if it can tie into remote monitoring so your wife or kids or caregiver can remotely monitor from a PC or a cell phone, like a smartphone, and then if you can graph it. So listening to all of this, it was like science fiction. It was like, beam me up, Scotty. But I am proud to say, after 4.5 years of R&D, this is what we've done. We've created LifeWatcher, and what you'll see here is my meals. This is everything I ate and drank for the day. The system automatically extrapolates the kilocalories, carbs, and salt. So now we're capturing real-time lifestyle data. It's being managed and graphed. I wake up in the morning, I take a shower, I jump on the scale. On the way to work, I use my cell phone to access LifeWatcher. I input my weight and my blood pressure. That's it. Throughout the day, the system does the rest. And some of the information we're gathering is this window into real-time social habits. Some of the information that's come out is quite interesting. This is in Japan, and what we've seen here is just the accuracy and frequency of the times that people eat. We can tell actually which restaurants drill down, which restaurants people are visiting, and more important, the next slide, here we have real-time demographic profiling. So this actually shows you people in their 20s, 30s, and 40s, what they've been eating throughout the days. This is from our consumer study. And here you can see the trends that traditionally people in their 50s are eating Japanese meals, but younger people are eating more Western combination. And we look at exercise, and this is real time. We know who's exercising, what are they doing. And one of the interesting patterns is if you look from the 20s, 30s, 40s, and oh, something's missing in their 50s. Well, what's the takeaway? What have we learned from this? Data transforms opportunity. Now, I think one of the questions John was asking has to do with healthcare IT and perhaps why it failed. I believe this is the first time in the history of the world that we've been able to capture real time people's lifestyle, meaning doctors can intervene. We have smart systems, smart algorithms, databases, behavioral change, motivational mailing. So actually, if you go over your carb and salt or don't exercise, tomorrow's message sends me an email message to my phone, and it insults me. It gets progressively stronger. So people are reacting and trying, ooh, did I really do that? Next, disease prevention and management through lifestyle. 2 weeks ago, I was watching Larry King Live, and they were talking about, excuse me, cancers. 2/3 of all cancers are preventable by lifestyle modification. You can alter, change, or delay the onset. Well, I work in diabetes, obesity, cardiovascular weight loss, which is all lifestyle related. And it's absolutely amazing that I, as a CEO and chief care architect during development, I tipped in 3 years ago and became a type 2 diabetic. It was shocking. And my wife forced me to use my own system. I have all the data every 3 months to show you. I tipped out within 6 months. I completely reversed my diabetes. I've been off my meds for 3 years. But 1 week before coming here, I tipped back in because of travel, busy schedules. I reverted to bad habits. And if it can happen to me, it can happen to you. The last one, mobile transforms access to bottom of pyramid. You may be wondering why in the kingdom I have 2 cell phones. This is a 2.5G clamshell phone, 6 years old, and we've coded and everything works on LifeWatcher here, as well as iPhone, smartphones. But people at the bottom of the pyramid where we're working in emerging markets, they can't afford a $1,000 phone. You know, they're on $100 per month budgets. But mobile systems has reduced the cost, and now we're helping, we're saving lives, we're extending lives, and we're actually preventing diseases for 3 billion people. And it is my hope that today, with such an illustrious audience here who does have the power to help your employees maintain better health and wellness, as well as national governments, Ministry of Health, to deploy these real-time systems to save lives, and especially the lives of your children. Thank you.